take Trehalose and then eat the glucose load, it will not spike your glucose nearly as much. If you have no muscle mass, then you're going to have low creatinine levels and your GFR is going to look great even if it's not. We know that people who have low cholesterol, they have increased risk of depression and anxiety. They're using what's called an elastic regression theory of aging. It's not an accurate theory of aging. I think you're getting hit in the head playing sports, even minimally. I would be drinking my ketones before and after.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
You know, you guys know my criticism of epigenetic clocks. You can actually change epigenetic clocks with very fast. I would like to see if somebody's on these substances for 2 days, whether maybe the epigenetic clock changed. Because I can tell you, I've seen changes in 2 days just by putting something in a supplement. Do I think that I changed their biologic age in 2 days? No. I think that there was some marker that changed that made the epigenetic clocks. Epigenetic clocks are just, in my mind, not quite there yet, right? I know some of you guys love them and more power to you, but I don't think we are there yet. They're using what's called an elastic regression theory of aging. It's not an accurate theory of aging. I think there's going to be better ways to look at aging. We've been using Generations Labs. That's a better test. But I think you have to be a little skeptical right now of a lot of these clocks. So you always hear about high cholesterol, right? But not a lot of doctors are talking about low cholesterol. And then what do? What are strategies to increase it if we do see low cholesterol? I do think we are doing a lot of harm with lowering cholesterol too much. So when we know that when cholesterol gets very low, that there's risks associated. We know that people who have low cholesterol, I'm talking about less than 160, they have associated increased risk of depression and anxiety. They have increased risk of hemorrhagic strokes. They have increased risk of cancers. They have increased risk of infections. Cholesterol is actually crucial for immune function. So when cholesterol gets too low, immune function suffers. So, and we know that there's brain volume changes in people who have lower cholesterol. So really an optimal cholesterol is probably somewhere between 170 and 250. But again, we do want the right types of cholesterol, right? So people always think about HDL being the good cholesterol, LDL being the bad cholesterol. We've talked a lot about this. Apolipoprotein B, apolipoprotein A. B is all the cholesterol being fed out of the liver and being distributed. A is recycling it back. You want that B to A ratio to be less than 0.6. So that's what you want to look at when you're looking at these ratios. So even if you have a low cholesterol, if that ratio is good, that's good. But a lot of times we'll see that ratio bad in people with low cholesterol because there's actually a problem. GFR, glomerular filtration rate, is a measure of kidney function. In a normal metabolic panel, it's measured off of something called creatinine. So it measures creatinine, and then a computer that's in the background takes the GFR as a computed number from the creatinine level. So the problem with the GFR in the first place, as it appears on a comprehensive metabolic panel, is that there's a lot of things that elevate creatinine besides kidney disease. Number one, if you have a lot of muscle mass, you are going to have higher creatinine levels. If you have no muscle mass, then you're going to have low creatinine levels and your GFR is going to look great, even if it's not. But if I have my big muscly bodybuilders, they're going to have high creatinine levels and doctors are going to think they're in kidney failure and they're not. They just have a lot of muscle mass. If you're taking creatine, it will measure as creatinine. So that'll make your GFR look lower, even though it's not real. High protein intake will raise creatine or creatinine. And that will also make the GFR look lower. So we don't like the creatinine GFR measurement that comes on a comprehensive metabolic profile. So here at our clinic, all my CCs and doctors are trained in is using what's called a cystatin C. And you can actually calculate a cystatin C, use cystatin C to calculate GFR. Cystatin C is this protein that's produced by all nucleated cells and is filtered by the kidney. So it's not influenced by muscle mass or diet or anything else, creatine intake. So a lot less variability, much better correlation with GFR. So when I hear people say I have a low GFR, number one, I want to make sure there's not a fake number. You have to calculate it off of cystatin C. So Scott asks, I know ketones are helpful for energy and focus, but I recently heard about their role in traumatic brain injuries. Can you explain how ketones support traumatic brain injuries? I love this question, Scott, because after traumatic brain injuries, the brain can't utilize glucose well. So the brain's ability to utilize glucose becomes impaired, and that worsens the injury outcome. So if you can immediately get ketones to the brain as an alternative fuel source when this glucose metabolism is compromised, so that's going to be those first, 4 or 5 days afterwards, you're going to be needing more ketones because the brain's not utilizing its regular glucose source of energy. So beta hydroxybutyrate can cross the blood-brain barrier pretty immediately and give that energy back to the brain. So you're going to inhibit a lot of the bad effects that you get a few days after an injury. It's also super anti-inflammatory because remember, once you get hit in the head, it's the secondary issues. It's this big inflammatory response that does further damage. So if we can reduce that secondary inflammatory response with these reactive oxygen species produced and this microglial activation, and ketones do exactly that because we talked about how anti-inflammatory they are. They also protect mitochondrial function. They decrease this calcium influx that goes to the brain. So I would say not only are they beneficial, but I would tell people they are critical to utilize, especially if you have a significant hit in the head, right? A significant concussion. You're a kid who plays football. In fact, I would say if you're getting hit in the head playing sports, even minimally, I would be drinking my ketones before and after my sports. They're that useful to the brain. So those of you guys who have not heard me talk about Trehalose, it's a sugar. I love it. It's a disaccharide. It's basically 2 glucose molecules, and it's naturally found in various organisms like funguses and certain plants. And it's garnered a lot of attention for its health benefits, particularly in relation to neurodegenerative diseases and to metabolic health. Like if you take Trehalose and then eat a glucose load, it will not spike your glucose nearly as much or your insulin nearly as much. So when we look at the benefits, super protective to cells, induces autophagy, neuroprotective, improves metabolic health. I love Trehalose. You can put it in your coffee. You can cook with it, add it to your protein shake. I love Trehalose. Julie is from Minnesota, as well as the most important way to turn down the volume of chronic inflammation. So obviously it's the basics at first, right? Are my nutrients good? Are my plasmalogens good? Do I have hormones, right? I'm going to have chronic inflammation if I have no progesterone, whether I'm a man or a woman, or I have no testosterone or no estrogen, whether I'm a man or a woman. So first thing, get the basics taken care of. And then obviously, are you exercising? Are you sleeping? Are you eating shit? Those are the easy things, right? But the big paradigm that I'm really trying to educate everybody on is that restoring redox, or reductive oxidative balance that occurs at the mitochondrial level, is at the root of treating chronic inflammation. So if I have somebody who's chronically inflamed and I've gotten everything looks good, right? Gotten their nutrients good, their hormones good, their lipids look good, they have plasmalogens on board. Plasmalogens are important. Then I'm going to look at mitochondrial health and make sure that my mitochondria are functioning well. Because if my mitochondria aren't functioning well, then what's happening? I'm going to be making a whole lot of reactive oxygen species. My mitochondria are like, revving up, trying to keep up. They're making a whole lot of reactive oxygen species. I can't keep up with that. I'm in a chronic state of oxidative stress. Mitochondria also are signaling a lot of the pathways to inflammation. So remember that they are involved in activating our immune cells and releasing pro-inflammatory cytokines. I think that gets forgotten. That when you look at mitochondria's role in activating inflammatory cytokines. So key is, remember that redox balance, whether you have too much reductive stress or too much oxidative stress, is going to create mitochondrial dysfunction. Mitochondrial dysfunction is going to stimulate an immune response, and you're going to get chronic inflammation. So we have to support mitochondria.